I wonder when nurses and healthcare professionals became such attention whores. I'm old enough to remember a time when they were knowledgeable and trustworthy. There was a sense of comfort for a kid leaving the classroom to head to the nurse's office after getting drilled in the face on the playground, or having them put you at ease before preparing you to see the doctor for a visit you certainly weren't looking forward to. This video will make you puke if you ever thought our healthcare system had a bright future. Now that our culture has been stricken with the sickening malignant disease that is social media, healthcare can be a noble profession, but only if you have the desire to help others and be a productive member of society. Nurses, medics, and aides from all services are essential to the structure and safety of our communities. As our population gets older and fatter, more and more good nurses are needed in the medical field. Not only does it create jobs and careers sufficient enough to live on, but it can grant workers a level of pride and gratification through helping people, rarely achieved in any other profession. They become the unsung heroes in catastrophic situations like war and natural disasters. If history has taught us anything, nurses and medics are indispensable to public safety and remain a critical link to current healthcare practices and to the psychological well-being of the sick, injured, and dying. At some point, prospective nurses have to view their future positions as much more than just a job. It's a way of life, especially when they'll be spending the better parts of their days and nights slugging it out at some hospital or clinic, dealing with the irate, traumatized, and unpredictable public that cycle through their ever-revolving doors. Not to mention dick-headed doctors, lazy co-workers, and having to wipe asses and clean bedpans after patients poop kilos. Anyone who doesn't have a goal to help people and aren't willing to make sacrifices for the cause most likely won't survive the arduous training and endless study hours involved to become one of these underrated professionals, depending on where they go to school. But somehow the disgusting penchant for fame and recognition has slithered its way into one of the world's most respected career fields. And now viewers can choke back the urge to vomit when they witness the posturing and the audacious self-importance of some of these so-called professionals and their desperate attempt to be distinguished. It's hard to believe all this garbage isn't breaking some sort of HIPAA law, but it can definitely stifle the significance of these coveted job titles. Like we're supposed to have respect for a nurse blogger posting the equivalent of a glow-up video, or the classless salary exhibition of a brand new graduate. But every time I see this crap, it seems to chip away at the already dwindling confidence we have in our healthcare system. It's hard to imagine how self-centered you'd have to be to put a camera in your face and expect the world to care about doing a job that should otherwise be selfless. And what will some of these glow-up bitches do after a few years of night shift when their faces are baggy and they're all old and folded over from having to face the joyless humility of the workforce? Or when the internet steers its attention to someone or something new and they have to actually learn how to heal instead of just handing out meds. It makes me think of the war nurses and the altruistic caregivers of so many tragedies and conflicts in history. They didn't discriminate or try to politicize their purpose, and they sure as hell didn't need acknowledgement or praise for their generous actions, although they certainly deserved it. Blah, blah, blah. It's effing terrifying to think that someday one of my loved ones could be on their deathbed or in need of something really serious like palliative care, only to be faced with an egomaniac incapable of critical thinking and far too self-absorbed to give my family member the proper treatment they need. Because in the back of their mind, they'll be thinking about the next video they're gonna post or how many likes and follows they might be receiving while they're stuck at work and away from their precious cell phone. Anyway, best of luck to you and your family next time you gotta go to the emergency room.